Hello guys, welcome to my YouTube channel Let's Join Pharmacy. Yes, here today let's discuss about how to write pharmacology of any drug. If any drug is given in your examination, then how to manage that drug? How can you write the pharmacology of that drug? See, many times what the examiner will do, what the question paper setter will ask, he will ask directly write the pharmacology of atenolol, write the pharmacology of calcium blockers, write the pharmacology of alpha adrenergic blockers, beta adrenergic blockers, write the pharmacology of the in vitro oral anticoagulants, write the pharmacology of the in vivo oral anticoagulants, and write the pharmacology of the some of the lipidic drugs, hyperlipidemia drugs. This type questions have been asked many times in our examinations. So what the students are doing, they just leaving the question here. So intentionally what they will do, they will leave these questions. So now these points you understand and don't leave the question. Yeah, now what you have to write in pharmacology? See, for an example, if they ask in the question write the pharmacology means, then first you write the which drug they have given. Means for an example, now they have given the write a pharmacology of the amlodipine. Now this amlodipine, you all know that it is the amlodipine, it is one of the calcium channel blocker. Yeah, first you have to write that one. Amlodipine, it is the calcium channel blocker. It is used to treat the hypertension. Okay, you can write that one. After that, the main point you have to write some, means just it acts mainly on the calcium channels. It's a short mechanism of action. Okay, for all I am telling, same procedure you have to follow. After writing that one, what you have to do means at next step, first you wrote the definition of the drug, which drug they have given, then you wrote some of the short mechanism of action, MOA. Then what you have to write means now for an example, they have asked the hypertension. Okay, hypertension, you can write there, basically you can write there direct, you write the mechanism of action of that drug after that. Okay, now see, amlodipine, mainly it is a calcium channel blockers, nifedipine, these all are the calcium channel blockers. What they will do, they will just inhibit the calcium channels and they prevents the contraction of the muscles of the heart. So that way what happens, automatically there will be vascular dilation happens, and automatically what happens, your BP comes to normal, means BP get decreases up to normal. This point you have to write down in the mechanism of action. After writing mechanism of action, then what you have to write, you have to write the pharmacokinetic properties. Okay, pharmacokinetic properties means the drug, where the drug get absorbed. Now see, most of the drug get absorbed in the GIT, gastrointestinal tract, most of the drug. After that, some of the drugs they get absorbed in the intestine, in some of the drug get absorbed in the intestinal lumen. Okay, these points you have to write. But if you don't know anything means, you can write the maximum, means pharmacokinetic of this drug is the absorption takes place in the GIT, gastrointestinal tract, and this drug is orally taken. This type you can write. Okay, orally administered. Okay, this passion in pharmacokinetic you have to write. In that pharmacokinetic, one more very important, half-life period also you have to mention. Half-life period, what is the half-life period of the drug, that also very important. And also you have to write the metabolism. See, extensively maximum drug metabolism takes place in the liver only. You can write that liver. And first phase metabolism means oral hypertensive agents, means oral antihypertensive agents, actually they all get metabolized in the liver. Okay, so it follows the first pass metabolism. So you can write there metabolism, first pass metabolism. It is also comes under the pharmacokinetic property. Okay, at last you can write the elimination. Maximum of the drugs they get eliminated in the form of urine or in the form of fecal matter. You can write the drug get eliminated in the form of urine, some get eliminated in the form of fecal matter, but not all. Some drugs will get eliminated in the form of fecal matter, maximum in the form of urine only they get eliminated, means excreted from the body. Yeah, this you have to follow, this basic you have to follow for the pharmacokinetic. Then after that you can directly write for the contraindications. Means some of the drugs they are not given in pregnant ladies, in lactation and in kidney failures, severe liver cirrhosis patients. These are the contraindications. Adverse effect at last you can write. Okay, common adverse effect for all the drugs are nausea, vomiting, headache, then loss of appetite, then body pain, rashes on the body. These are the common mechanism of action you have to mention. See, this is the pharmacology of the any drug. Even they will ask in the pharmacology of which one, in pharmacology subject they will ask the pharmacology of amlodipine, you write the same. Okay, same pattern you have to follow, but here only changes is definition, mechanism of action. Okay, maximum pharmacokinetic properties also same. Dynamic means that mechanism is also means only mechanism you have to write correct. Then pharmacokinetic properties is also same. Elimination, then absorption, metabolism, these all are the same here. And one more very important point you have to remember is half life period also you have to mention there. Then side effects are same. Contraindications also not, means they are not totally different, they are also same here. So if you remember this point, means there is no hesitation for you to remember any drug. So you practice these points, you follow this one. These are the very important tricks or tips for you to remember the pharmacology of the any drug. Clear? Thank you. And now in other video, means in upcoming video inshallah we'll discuss about the how to remember the drug name. Okay, now for an example they are given calcium channel blockers, then 4 to 5 examples how can you remember in that calcium channel blockers. Then how can you remember ACE inhibitors, that is angiotensinogen converting enzyme inhibitors, how can you remember that. Then some of the beta blockers, how can you remember that. Alpha blockers, how can you remember. Okay, beta adrenergic blockers, alpha adrenergic blockers, how can you remember that all. Some tricks and tips we can discuss in the upcoming videos. So subscribe our channel at Gen Pharmacy. Thank you.